Hello folks, welcome to Legacy IAS Academy. In this video, we will be discussing a current affair topic presented to you by your faculty, Sushma KP. So what is the topic that we will be looking into today? What India's cancer map shows. Understanding? Now, first and foremost, before we begin the topic, let's start with a question. With reference to cancer incidence in India, consider the following pairs. Oral cancer is the most common cancer in men, overtaking lung cancer. Breast and cervical cancer together account for 40% of female cancer cases. Prostate cancer is most common in rural areas in India. See, first we'll take oral cancer. See, with respect to men, if you take in cancer, it is because of two major things the cases are higher. One is oral cancer and another is lung cancer. In recent times, the oral cancer has surpassed your lung cancer, so making it the most common in men, overtaking the lung cancer. So the first statement is correct. The second statement, breast and cervical cancer together account for 40% of female cancer cases. See, with respect to female cancer cases, they are at high risk of cancer, but also the death rate due to this cancer is less. So this is the most amount which is contributing to female cancer. Third one, prostate cancer is most common in rural areas. See, it is correct up until here only this terminology. It is not very prevalent in rural areas, or we are not telling there is no prostate cancer in rural areas, but the incidence is more common in urban areas, especially in your Delhi, Mumbai, understanding. So basically tier 1 cities. Again, why? Because of lifestyle activities, and we will discuss all of those in the further, but as of, if you see with respect to prostate cancer, it is more prevalent in urban areas. So this statement is wrong. So the correct answer is A, 1 and 2 only. Now if you see with respect to what I'm using here is India's cancer map. If I would say India's cancer map, which is, we will start looking into some registry, cancer registry, which means how is the concept of spread around in our states and union territories. Of the 15.6 lakh cancer cases, 8.74 lakh is leading to death. Understanding? In that, Mizoram has the highest risk with respect to both men as well as women, which is 11% above the national average. Understanding? So this is how the prevailing situation is. Now, why are we discussing this topic? If we know the statistics, then why are we discussing this topic? That is because the World Health Organization has been claiming that for more than a significant number of cancer in patients can be, when early detected, treated. We all know there is no cure for cancer as of now, but in the early detection stage, it will have a very important, significant step in reducing the number of cancer cases with respect to the care available. Understanding? How can we know that? Through your cancer registries. What are these? These are nothing but the data which is collected with regarding to people who are affected by cancer, state specific, union territory specific, the death rate because of. According to the cancer registries data available, this shows that 10 to 18% of Indian population across the states and union territories. Now, one of the main reasons as to why this data will be useful, if you say it is for policy planning, screening programs. Now, for example, under your Ayushman Bharat, okay, even your primary healthcare centers will be equipped for screening, okay, raising awareness programs. Understanding? So these are the kind of things that will be more effective in trying to, and with more awareness generation, And with respect to, let's say, in female cases, let's say breast cancer and all, they will be more prone to uh, identifying it easier. Why? Because they can physically check it themselves, but the other things are not that way, right? So because of that, what happens, the issues of the screening itself is becoming very less. But with these introduced screenings, it becomes a possibility to early detection becomes easier. Understanding? See, now if you say with respect to your breast and cervical cancer, we have seen that they together amount to 40% of cases. Understanding? And if you say with respect to the incidence of how the cancer is with respect to the division in the gender, women are of higher instance of cancer. Women are of 51% chance, whereas the death rate, if you see because of the cancer, it is 45%. Again, why is it possible here? Because of one simple thing: early detection, and also better vaccinations now there are there of preventative steps. Understanding? And with respect to men, the more increasing one are your lung and gastric cancer. This is becoming more harder to detect. Understanding? Now, why is it becoming more harder to create? In the question starting itself, we saw rise of oral cancer has become very more. Why? Because first and foremost, the reason one we have to observe here is, despite the fact that tobacco consumption, okay, which is one of the most important risk factors for your oral cancer, has gone down considerably, meaning the percentage of adults consuming tobacco decreased from 34.6% to 28.6% according to your global adult tobacco survey. Despite this, they are finding it that the oral cancer is increasing much more. Understanding? So this is one issues. And also one of the main adding contributes is also tobacco and your alcohol consumption. Understanding? So this dual use is further amplifying the risk. Now, before we continue further, if you're someone who is looking forward to kickstart a UPSC civil service journey, look no further. You have found the right spot with Legacy IAS Academy, which maintains a batch size at 40-member per limit. One of the reasons you have to consider Legacy IAS Academy is also that it offers one-on-one mentorship, regular interaction with educators, and also there is daily means answer writing challenge, prelim mock test series, interview analysis, and interview mock test. At the same point of time, we also provide 360-degree or a holistic current affair analysis. We also offer our classes in both online as well as offline mode. For those of you who are working professionals or students, we do offer weekend courses. For more information, you can contact the number given below or check out Legacy IS Academy website. If you want to see how the classes are for yourself, schedule a class or demo class online or offline. Now let's come back to the issue at hand. If you say compared to all the other places, the concept of cancer with respect to the mapping, if you see with India, Northeast has higher prevalence or higher cancer incidence. The common cancers in women are cervical cancer, lung cancer, and with respect to oral cancer, it's most prevalent in both men and women. Why? Again, high tobacco usage and also a unique dietary habit such as using smoked meat, trying to use fermented pork fat, som, and a large usage of soda as additive. And also, if there is existing HPV, that again, hepatitis typhoid, it aggravates the conditions, right? And if you say with respect to which state specifically in Northeast is most affected, it is Mizoram, where men are at a highest lifetime risk of 21% and women at 18%. And highest oral cancers apart from these are your UP and Bihar, also apart from northeastern states. And breast cancers are more prevalent in urban and metropolitan areas, and prostate cancers is further for increasing in urban areas. Why do these findings become important for us? Because as we said, screening or early detection makes it very very important in order to move towards a secure India or a healthy India. How are we telling that? Because WHO has told that 30 to 50% of cancer are preventable through early detection, understanding, or you can avoid the risks. Okay, so through this we are giving the necessary HPV vaccination, cervical screening, right? And also through your Ayushman Bharat, primary healthcare centers are giving the screening. So how can we, what are the preventative measures? First is awareness and screening. One is self-examination, example with respect to breast cancer, regular checkups, and also cervical cancer detection, HPV vaccination. So all of these are increasing and alongside added to your national immunization programs. Another important aspect is your lifestyle modification with respect to tobacco cessation, with respect to anti-tobacco campaigns, reduction in alcohol consumption, and also the healthy diet which is needed, and your physical activity, right? So, and also one of the most important thing, community awareness and community involvement. Only this is one of the ways if we have to deal with cancer as a holistic approach. So if you see how India's cancer map is, it highlights the regional inequalities, lifestyle risks associated. There is also a good chance that we can use this data in order to turn it for good, meaning early detection, lifestyle change, vaccination, awareness campaigns. So with this, we will be able to combat this issue better. With this, we'll come to the end of the content. If you like our content, subscribe to our channel, hit the like button, share it along with your friends. Thank you.